Hi, everyone. It's Jen Nazarino, Academic Director for the online MPH program. Welcome to our third installment of the Leadership in Action webinar. We are so excited for you to join us. We're just going to wait for a little bit, just about a minute or so for folks to log on. But again, welcome and also Happy New Year, January 2024. We have just started our semester, and I'll be actually teaching this semester, which I'm really excited about. But again, I wanted to thank Dr. Nuzzo for being with us. Quickly, I will provide an introduction. She is a professor of epidemiology and director of the Pandemic Center at Brown University School of Public Health. She's also a senior fellow for global health at the Council on Foreign Relations. An epidemiologist by training, her work focuses on global health security, public health, preparedness and response, and health systems resilience. In addition to all her scholarly work, Dr. Nuzzo regularly advises national government and for-profit and nonprofit organizations on pandemic preparedness and response, including COVID-19. She regularly engages with media to educate and inform about emerging health security trends. Her articles have appeared in the New York Times, the Washington Post, the USA Today, Fox News, Politico, The Hill, and the Boston Globe. She was featured in Debunking Borat, a television series on Amazon Prime Video, and her work was featured on Last Week Tonight with John Oliver. We're very lucky to have her as our featured guest tonight. And I'm going to turn it to Nithya to introduce herself, and then also for our OMPH students to introduce themselves as well.
Thank you so much, Jen. Hi, everyone. I think at this point, most, if not all of you know me. I am the manager of MPH programs at Brown University School of Public Health. I'm a dentist by training, and I'm currently in a doctoral program, finishing up my program. So just like you all, I'm also doing an online program as I'm working. So I know how the struggle feels. I'm really excited to have Dr. Jen Nuzzo here. I'm very excited to hear about the Pandemic Center and more about the work and how you got to where you are, and the career path you've taken. I'm going to turn it over to our moderators. I think we can start with Sean, maybe.
Sure. Hi, everybody. My name's Sean McLean. I'm entering my I think this is actually the beginning of my second year, full year. I'm in entering my fifth semester here at Brown. I'm really happy to be here, part of the online MPH program. Being part of the Brown community has been a dream of mine for a very long time. Going back many years, I currently work outside of Brown for the American Red Cross. I work as a disaster workforce engagement manager for the greater New York region. And that job involves a lot of traveling, especially for deployments to disaster zones. I spent a good portion of the fall in Maui following the wildfires that happened out there. So the online modality of Brown's program has really been an incredible benefit to me and my career, and it allowed me to pursue both of my dreams in the humanitarian world and academic world at once. I've gained a lot of interest through my time at Brown in both the socio-medical sciences, sort of interjection of sociology through some of my previous education was in international relations and government, so social and economic impacts on health. But I've also gained a lot of interest in epidemiology, so I'm very excited to learn more about different parts of epidemiology and understanding how that interacts on the international scale. I'm just very excited to work with everyone here. It's a pleasure to meet you, Professor Nuzzo, and I'm looking forward to hearing from everyone today. Thank you.
Lauren, could you go next? Thanks, Sean.
Hi, everyone. I'm Lauren Buchkowski. I am based in Pittsburgh, Pennsylvania. I am part of the fall 2022 cohort for the online MPH program. I have two kids, two little boys. I guess they're not little, 10 and 9. I am formerly an SVP for Bank of America. I work with public sector group covering clients, federal, state, and local, Department of Treasury, Postal Service, Health and Human Services, and Housing and Urban Development were some of my clients. I am currently working for business operations for a small engineering firm outside of DC. So I hope that I will get to come visit the Pandemic Center in the next couple months. I also am a research consultant for the National Academy of Public Administration in their Center for Intergovernmental Partnerships. And we are doing a lot of work kind of combining misinformation as well as social determinants of health, adding a public health lens to it, to some of their public administration work. I'm very excited to hear from Dr. Nuzzo and hear, the path of how she got to where she is. And I look forward to hearing from everybody. Thanks so much.
And then Kara?
Sure. Thanks, Jen. Hi, everyone. I'm Kara Bonatatabas. I'm calling in from Connecticut, where I live with my husband and 3 children. Sorry to outdo you, Lauren. I have a legal background by training. I spent close to 20 years in a combination of private practice, with the majority of my time spent in-house counsel at Pfizer, where I served in a number of different roles. Right before I left there, I was actually supporting our patient health impact team, which dealt with health economic outcomes and patient advocacy. I left Pfizer and more recently was on the executive team and served as a head of product and regulatory and compliance advisor to a software compliance and regulatory software startup. And currently on the leadership team of a local nonprofit called Filling in the Blanks, which provides access to food insecure children throughout Connecticut and New York. And I'm very excited to be a co-moderator on this panel and to hear from Dr. Nuzzo. Thanks.
Thanks, Kara. Maureen?
Hi, everyone. I'm excited to be here. I'm based in North Bethesda, Maryland, so very close to the Pandemic Center, and hopefully I get a chance to see it in the most recent open house coming up. So my background is in healthcare workforce development, and I am currently a policy consultant for a rare health group, and I'm working on a variety of projects involving behavioral health policy in California. I was also a 2022 Emerging Leader of Color Fellow for the National Academy of State Health Policy. And I'm also part of the fall 2022 cohort for the online MPH program. So excited to learn more about Dr. Nuzzo and her journey here.
Maureen. And Joey?
Hi, I'm Joey Townsend, joining from North Palm Beach, Florida. I started the OMPH program in the fall of 22, like my colleagues here. My professional background is on the workplace and human behavior side of things. I consult to businesses, their founders, investors, boards, executive leaders who want to create sustainable, highly functioning, and equitable workplaces. For the first 2 decades of my career, I was a Fortune 500 HR executive based in New York City and responsible for global workforces, policies, and programs. My experience includes running talent and development functions for companies like MetLife and Bank of New York Mellon, and serving as the chief HR officer for OneMain Financial, which is a publicly traded mid-cap consumer lending company. I have a PhD in industrial and organizational psychology and an MA in experimental psychology with a focus on cognition. And I am delighted to be a part of the conversation this evening, and I'm really looking forward to learning more about Professor Nuzzo's experience and hearing from my colleagues as well and what kinds of curiosities they have.
Thanks, Joey. I'm always impressed by our students. I know what you all do, but it's still always impressive to hear. So I'm going to turn to Kara and, well, first to Lauren and to Maureen to start us off.
Great. Dr. Nuzzo, we wanted to kind of take a step back before we dove into everything that you're doing now and get a sense for how you got started. What were the first influences, either classes or people or a situation that really garnered your interest in public health?
Thank you for that question, and really thank you for inviting me. You all are amazing, really extraordinary. I'm so always impressed by public health students and what brings people to this field and the enormous talents that people bring with them. But I have a special place in my heart for people who do degrees part-time, because I did. So I'll tell you a bit about that, but just really thank you. It's a real privilege to be with you all. In terms of what brought me back to public health, I mean, I don't know how far back I should go, but it probably started in college, which is that I sort of discovered public health accidentally. I had been an undergraduate environmental science major, and I was really interested in the environment, not really interested in people per se. And I needed a job one summer, and I saw this research opportunity through the National Science Foundation. It's called Research Experience for Undergrads. And it was about how like environmental research can affect public policy. And we were going to spend a few weeks at Howard University in Washington, D.C., learning about the public policy side, and then the rest of the summer working at New Mexico State, doing some kind of environmental research project. So I needed a job, and it sounded pretty interesting. So I applied for it and was accepted. And I initially was going to be placed doing field work in the desert, studying desert microbes, which sounded amazing. And then at the last minute, the mentor backed out and they had to reassign me to a project. And I was reassigned to a virology lab. And I was crushed because I was like, virology, that's not really an environmental issue. That's like a human health issue. And who's interested in that? And so instead of spending the summer in the Southwest desert studying desert microbes, which sounded very fun and beautiful and amazing, I wound up spending it in a windowless virology laboratory studying various viruses. And you could tell what I do, that was clearly pivotal. And it was pivotal in a number of ways. One, it made me interested in human health. Two, it introduced me to the field of public health. And three, the mentor put on my radar the possibility of going to graduate school, because that wasn't really something I had imagined for myself necessarily, and didn't think it was necessarily a good candidate for it. But the mentor thankfully said, no, I think you would be good and you should consider applying. So when I went back to my undergraduate institution, I talked to some folks, and I had a professor who was kind of had one foot in the environmental sciences and one foot in public health, and said, you should go to the Harvard School of Public Health and get your degree. And so I said, okay, sure, that sounds good. And I did. I got a job after my master's as an epidemiologist in New York City. And I had studied in my master's program infectious disease epidemiology and environmental health. My degree is actually in environmental health, but I got really interested in this rising kind of issue at the time, which was New York City still doesn't have a filtration system for its water, and there were questions of whether that was good enough. And so New York City, as a result, had to hire epidemiologists to continually monitor water data and also the epidemiologic data to make sure New Yorkers weren't getting sick. And so I was hired as part of that kind of policy determination. I had my interview with the city in like spring 2001. And they were telling me that, you know, I'd have certain responsibilities, including running certain surveillance systems that were meant to tell if people were getting sick drinking New York City's water. And I remember at the interview, someone saying to me, you know, these systems could also be useful if there were bioterrorism. And I remember thinking, like, that's just nuts. Like, who's worried about bioterrorism? Like, that just sounds like absolute science fiction. Flash forward a few months later, we were very worried about bioterrorism. So with the events of September 11th, my career, my life just completely changed. And what had previously been described as this like offshoot remote possibility aspect of my job actually became a much greater focus of my job. So I worked there for a bit, and then, you know, I sort of felt like as a practitioner in public health at that time, the resources that we had were exceptionally limited. And it was very hard, I felt like, to do the job right with the tools that we had. And so I got more interested in policy. And I had been reading this book at the time. It's called Germs. And it was written by a New York Times reporter. And it was all about the Soviet biological weapons program that was discovered when these defectors came out of the USSR. And it was just really fascinating. And it was really fascinating for the time that we were in. And in it described a research center at Johns Hopkins that was actually really thinking very hard about the possibility of the misuse of biology for political purposes. And that if someone were to, you know, use a biological weapon, who would be on the front lines of that? It would be medical and public health providers. And so they needed to be part of the planning. And so I just became really fascinated by that. And so like, I just looked up that center and they were posting a position and I applied to it and I got it. That allowed me to work for 13 years with Dr. D.A. Henderson, who had lots of sort of claims to fame in his career, but the thing he was best known for was that he had eradicated smallpox. He led the global smallpox eradication program, which that was a really extraordinary experience. He had previously been the dean at Johns Hopkins. And so he, sort of knew the Johns Hopkins educational world as well as the research center that he founded that I was working for. And while I was there, they developed a part-time program to do a doctorate in epidemiology. And I knew I didn't want to stop working. I had actually loans from my master's degree, and I didn't want to stop earning an income and stop paying back those loans. So when this part-time degree became a possibility, I jumped on it. And so I applied and was accepted and wound up completing my doctorate of public health there. I'm sorry to say that Johns Hopkins doesn't have that DRPH program anymore. They have a DRPH program, but it's not the same as the one that I did, and epidemiology doesn't participate. The one that I did was the same as the PhD program. I was allowed to do it part-time. And so from that, I can tell you it is not easy to complete a degree part-time, even if your full-time job is very aligned with what academic requirements you may have. It's just, you have different lives. You feel like you're a split person for many, many years. And so I know how incredibly difficult it is. So I have a particular passion for helping people who are in that phase, because let me tell you, nothing feels better than being done with said degree. And quite honestly, I sometimes look back at that time of my life and think, if I hadn't had kids during that time and been able to go out on maternity leave, I'm not sure I would have been able to complete my dissertation, because I just had a little bit of less demands on me professionally during that. So anyway, I've been working on pandemic preparedness issues for the majority of my career. Because of the events of September 11th and the places that I work, it really kind of put me in this intersection of health and national security. When you think of things about like deliberate biological weapons threats, there's not a lot of models to look at. So you look at natural outbreaks, you look at the possibility of pandemics, you look at other things, and ultimately you look at all types of scenarios dealing with acute infectious disease emergencies and what we would need in order to prevent them, but also what we would need in order to respond to them. So that's how I got into this field. I was at Johns Hopkins, more or less. There's a long sordid story of how the center that I was at left Hopkins for a while. And actually, I heard somebody was from Pittsburgh. We actually joined the University of Pittsburgh Medical Center for a bit, but we came back to Hopkins. And when we came back, I joined as faculty, and I was there from pretty much until from 2017. I was on the faculty from 2017 until I joined Brown in 2022. And really it was the COVID-19 pandemic that made me want to tackle these issues through a different lens. And that's really what brought me to Brown, because I thought that Brown had that kind of interdisciplinary spirit and a lot of interdisciplinary collaborations that I thought were really, really important for making progress on the issues that I care about. So anyway, that's a very long-winded story of how I got into public health and how I wound up here in Brown.
Dr. Nuzzo, I really enjoyed hearing about your journey to public health and the Pandemic Center, and I liked how you were really guided by the mentors directing you in different interests and in different activities you should do. Was there any words of advice that stuck with you throughout your early career?
Yeah, I mean, first of all, I think it's about just telling you that it's possible for you. I think not all of us, if you haven't been exposed to people who do graduate, it's sort of what you see is what you think is possible. And so for me, the mentors were really helpful in sort of saying, that's certainly something that you can do, giving me the courage and the confidence to do it. That I think was really, really important. I will say, I mean, I had a ton of great advice from people along the way. But sometimes the mentorship was also sort of watching people that I thought were consequential and trying to study how they did it. But probably the biggest piece of advice I got was from one of my former bosses, who ran the center that I used to work for. Her name was Tara O'Toole. So DA Henderson went off to Washington for a bit, and Tara O'Toole took over the center where I worked while he was in Washington, and then stayed there for a while until she left to go into government herself. And when I told her that I was thinking of doing the DRPH, she was like, that's a great idea, do it, but recognize the best one is one that gets completed. And so just taking that very pragmatic step of like, you can get a lot out of your education, you can get a lot out of your degree program, but get it done. And she actually used a much more colorful language than get it done. I'm not going to repeat it, but let me tell you, that was an important mantra for me to channel at times in which it felt almost impossible that I was going to get it done. And then I don't know that she said this directly, but I absolutely say this to people who are doing it part-time. No one but you is going to prioritize the time it takes to finish your degree. And that may feel at times selfish, particularly if you have other demands, you have kids, you have a family, you have bosses, etc. Just know that it's a service to the field and the world for you to finish your education and to equip yourself with the skills to have the most impact in this field. So it's not selfish to take that time, but it's going to be up to you to like really carve out that time to make sure it gets done.
Thank you so much.
Before we move along too far, I had a follow-up question, Professor. So you mentioned a few minutes ago the challenges of doing a degree part-time while you're working that I think we can all relate to, certainly. Is there anything that stands out in your mind that you learned from working through those challenges that you've been able to sort of apply throughout the rest of your career to be more efficient? Or would you mind sharing?
Yeah, I mean, first of all, I think you're getting more out of your degree because you are working. I mean, I think back to when I did my master's program, I was straight out of college and I had no idea. You squander opportunities, you don't take advantage of the connection making because you just don't know that it's important. So as people who are working, you I think have a better sense of what you want to get out of the program, and I think you can better prioritize. So just to say that I think you bring tremendous assets to the process. The other thing is that, I think this is what life's about. We're constantly juggling and we're constantly trying to compartmentalize ourselves and then deliver in multiple areas. And I think if you can work and do a degree and get done, then you're going to be quite effective in the remainder of your career, because it really teaches you time management and the ability to prioritize, the ability to say, well, okay, I'm going to deliver to this point, but maybe I can't do it all. Maybe I'm going to have to, be happy with perhaps the less fulsome experience. I think you just learn how to manage. And that, I think that's pretty similar to what a effectual career in public health is. I mean, there's constantly trade-offs. I'll also say, for people who are parents or thinking of becoming parents, that further makes you prioritize, because you further have to compartmentalize and realize that, sometimes you have to get up at 5 a.m. and get something done so that you can get your kids off to school, or, you cram it in after they go to bed. And I just think that that's made me someone who uses my time more efficiently than, and I'm less likely to waste time than I was when I was younger and didn't have nearly as many demands on me.
Thanks, Jennifer. Thanks, Joy, for the question. I'm going to turn to Sean, who is going to ask about the Pandemic Center.
Yeah, thank you so much, Jenna, and thank you again, Dr. Nuzzo, for fantastic discussion so far and really incredibly relevant for everyone. So I'm just going to pivot gears just very slightly because I wanted to ask about, I know you have lots of experience advising, national governments, for-profit, nonprofit organizations, and everyone on, pandemic preparedness and response, especially in regards to COVID-19. And that's something that, was very interested in personal to me, both because I work in the nonprofit world, but also that I worked as an EMT during the pandemic. So I remember seeing that firsthand. It's I can only imagine how much went into behind the scenes on the actual response and, the pandemic, as, on the leadership side of advising for the pandemic. So I was wondering if you could maybe talk a bit about how your career up until now, in your advisement career, both the governments, for-profit, nonprofit organizations, how that led you to your role now as the director of the Pandemic Center. If you don't mind sharing a bit about that.
Yeah. And first of all, thank you for your work as an EMT during a very tough time, like for really powering society and helping out in a very direct and very risky way. I mean, you incurred risks in doing that. So thank you very much for that. I worked on pandemic preparedness issues for 20 years by the time COVID happened, been through, a number of crises, not firsthand, like taking care of sick patients, but from the advising side, from the policy side, from the, helping decision makers side. And actually, this is the second pandemic of my career. There was a pandemic in 2009, the H1N1 influenza pandemic, and that happened at a time just after there was a switch in government. So the Obama administration had been elected, and there were not even people in the roles that we needed. So there hadn't yet been a CDC director. There was an acting, interim. There wasn't, they had just, I think, appointed the secretary of HHS, but they didn't have a secretary of DHS. So anyway, there was not a lot of folks in the seats that we needed to have filled. And so those of us on the outside who had been interfacing with these agencies, were kind of pulled in to help like advise just because there weren't people there. So I wasn't a stranger to the advising role and to the, public commentary role on the policy thing. And there were many other events that happened in between, before and after, right? There was Zika virus, there was MERS, there are all these different kind of emerging infectious diseases that had a dimension of crisis in some way or another. And actually I, had already seen sort of SARS-1 and thinking, anyway, it's just to say that all of that, I don't think prepared me or any of us for COVID-19. And it just, to me, I just felt like we have to throw out everything we've ever done before, because this is just not right. I think so. There were so many flaws in our assumptions. There were just so many things that we expected to work that didn't. There were so many resources that we assumed were there that weren't. I mean, there were just a tremendous amount of mistakes and challenges. And, every country struggled, but the United States struggled spectacularly. And one of the projects that I run is I run something called the Global Health Security Index, the first of which we published in 2019. And that index ranks the United States as being the top in the world for its level of preparedness. Now, the report very clearly says that no country is prepared and all countries had gaps, but compared to other countries, the United States was very highly prepared. And I remember at the first kind of press conference of the pandemic where President Trump spoke with his kind of COVID advisors behind him, he held up my report and said, "Don't worry, we're going to be fine. Johns Hopkins says that we are the best in the world. Everything's great." And I wasn't watching the press conferences because I'll be honest with you, I couldn't watch them. They were just like, I couldn't, there are some political leaders that I can watch on TV and he wasn't one. So I just couldn't watch it, but my phone started blowing up because he had just waved my study in the air and said, "We're going to be fine." And then that was there were many moments in the pandemic where I knew, I'm like, oh my God, we've failed. And that was certainly one of them. And so it's what brought me to Brown, because I saw that so many of the things that we failed at were things that weren't strictly public health issues or medical issues. Like, yes, there were some public health failings. I think some of our strategies were not the right ones, but so much of the challenge was, social and political and economic. And, I thought to myself, well, I could either continue to work on these issues with my public health blinders on, through the lens of epidemiology and only epidemiology, or I could be serious about trying to fix them. And that would mean making partnerships and collaborations and availing myself of evidence from other fields. And that wasn't something that I could easily do where I was, because, very old schools of public health are very siloed, and I didn't have good collaborations outside of the School of Public Health. So I decided to go somewhere where I could do that more easily. And I'm very glad because at Brown, it's been as easy as possible as I thought it would be, in order to do that. So for me, it was about the event. Like I said, my career was shaped by September 11th. It was also shaped by COVID-19. And if I may, I think there's a career lesson in this, which is that use your public health training to give yourself tools to build your toolkit, but expect that you're going to apply those tools to a whole host of problems, some of which you see now, but some of which you may not even dream of existing, because we don't know how the world is going to unfold. But I think a meaningful career in public health is one where we apply our tools to the problems of the day. And, that requires having, good training and flexible skills, that you can then just roll up your sleeves and pitch in when there's a problem.
Thanks, Jennifer. I'm going to turn to Kara. That's really helpful. That's really great advice. It's really interesting. As we talk about what you mentioned about former President Donald Trump, we're going to actually ask you a question about great leadership, and we'd love to hear your thoughts on that. And I'm going to turn to Kara to pose her question.
Great, thank you. Thank you so much. And this is fascinating. And I also wanted to thank you for your comments in response to Joey's question a minute ago about skills and things that you develop when you're going back to school at we'll say, different season in your life, if you will. But yes, as Jen mentioned, a question that I wanted to ask relates to, in your opinion, what are some of the characteristics that you think make a great leader?
Yeah, I mean, so first of all, I think there's a dearth of good leaders in the world. So I'm counting on you all to fix that problem. But so first of all, I think humility is a really important skill. I think build a team around you and empower your team, and don't be threatened by your team. There are a lot of like really smart people out there that are surprisingly threatened by other smart people, and that's just like there's no room for that kind of thing. I in building the pandemic center, my first thought was like, if I could find people that are much smarter than I am on things, like that's a success. So build a good team. Actually, when I was thinking about creating when it was people found out that I was going to the pandemic center, actually, it was my husband's boss who gave him the advice. She's a very senior government official. My husband's a federal government employee. And she just gave him the advice. She said her first hire should be someone very different than she is. And as soon as she said that, like a light bulb went off in my head, because I knew exactly who that person was. And it's Dr. Beth Cameron, who was the first person that we hired. So I would say, make sure you surround yourself with really competent people. They should have different skill sets than you are, but work as a team and allow them to shine. Don't try to take credit for their work. Allow them to shine, empower them. You can't do it all by any means. And a well-functioning team, I think, is really, really important. Communication, transparency, treating people with respect. I think those interpersonal skills are probably as important, if not more, than your intellect. And then I think also being someone who asks more questions than you assert is also, I mean, don't get me wrong, I have a ton of opinions and a ton of positions on things. I'm not short of it, but I think it's also important to know what you don't know and then not be afraid to talk to somebody and say, can you explain this to me? I don't understand it. Or can you help me understand this? Because for me to tell you what a good leader is, I'm mostly seeing who's not a good leader and trying to say what's flawed about them. And I think the best ones are the ones, or the worst ones are the ones that just have an idea in their head. They don't try to socialize it. They don't try to get feedback on it. And they just kind of plow ahead and lead by authority or their position rather than leading by persuasion and rationale.
Thanks, Jennifer. We want to also broaden this conversation to talk about misinformation, particularly related to pandemics and particularly maybe COVID-19. I'm going to turn to Joey to ask a question about that.
Thank you, Jen. Professor Nuzzo, as we read, when we did Google you, and we heard in your introduction, you've got very high profile across different media outlets, very impressive places that you've spoken and consulted with. How can you help us understand how you've taken the approach? There were also some real pop culture bona fides in your profile. I mean, how many people get to have Borat in their resume? So can you give us a sense of how you've approached addressing and preventing misinformation through the use of different types of media and different types of maybe high and low sources?
Yeah, thanks for that question. So just to say that I'm not an expert in this, I feel like I'm someone who's a practitioner, if that makes sense. So I did a lot of public, speaking and media engagement throughout the pandemic, in part. Anyway, many experts did. Johns Hopkins, as you may have known, had developed this COVID map that a lot of the world wound up using. It was actually developed by one of my colleagues in the School of Engineering, Dr. Lauren Gardner. She and her postdoc developed the COVID map because they wanted to capture data for their research project. So it was like a research project, but there wasn't anything else like it, and it wound up being utilized by governments. I mean, also people, media outlets, et cetera. And so once the school recognized that, they really leaned into it, and they started being quite very forward-leaning in terms of communication. So we had, weekly webinars that press was on it. I had also had a lot of kind of press relationships just from prior media, prior events and engaging with press, over the course of my career. I work on policy, so engaging with media is really important for as a policy lever, because political leaders do stuff when they're reported on in the media, or they're maybe more inclined to do stuff. So I had already had a lot of kind of my own kind of so all of that taken together meant that I did a tremendous amount of media. I think in the first year, and because Hopkins tracked this very closely, because they're supported by Michael Bloomberg, who is a media mogul. So this is one of the metrics that he cares about. So the school cared about it, and they tracked it, and it was something like 30,000 media hits in the first 6 months. I mean, it was really unbelievably nuts. And so just in the course of all of those conversations, you just sort of, there was trial and error, honestly. It was, you could see which conversations went well and which ones didn't, and how things landed, and it just kind of refined it along the way. Side note, I really wish it weren't just trial and error. I think this is the public health aspect that we need to get better at, which is to bring more evidence to how you're supposed to be having these conversations. But that just would spill over. I mean, people would call me and just ask me things. And then I was asked to brief different groups, and, it just spilled over. On the pop culture thing, one of the ways which it spilled over is one of the people who called me was Sacha Baron Cohen, because he was making the Borat movie and wanted to make sure he and his castmates weren't going to be killed by COVID in the process. So I wound up talking to him throughout it, giving him advice on it, wound up being listed as a COVID advisor on the film, and then later was asked to talk to the QAnon conspiracy theorists who were in the film. I had, a celebrity Zoom with the Kardashians and all of these celebrities who, it was maybe 20 or so celebrities that collectively, I think their Instagram accounts alone reached about 500 million people. And they were just asking questions about the vaccines and COVID. And anyway, so just to say, we just had all of these things, and, you share information that you can. That said, the mis and disinformation problem is partially one of infrastructure. The information environment that we have is one that is very, very challenging. I remember this one time I got a question from a senior government official. This is somebody who had been in very high ranking positions, who, had a lot of authorities, who reached out to me as part of one of these, you know, hear me quoted and then wants to ask me a question, and asked early on, why is it that the FDA is withholding this life-saving COVID treatment of ozone? And ozone is not a life-saving COVID treatment. It's a lung irritant. And even if he didn't know that because he wasn't a biologist, like a 2-second Google would tell you that this is not life-saving. And I have to assume he Googled. I have to assume that he didn't find those results because the information environment can give you a very different picture of reality depending on who you are and what your search preferences are and what kind of things you're into and, you know, what kind of accounts you engage with. And just so hearing that and hearing like, if this guy thinks this, what hope does anybody have? So I just want to say, like, this is a bigger issue than public health can really fix. I mean, it feels like there's, you know, there literally is information warfare. We know that foreign governments are taking advantage of these algorithms that power our information environment to sow mis and disinformation. That said, keep engaging, keep sharing the facts that you can, do the best you can. At the end of the day, though, again, trial and error, I really found that I had the biggest progress with people, not just by simply delivering facts to them, but by listening, making them feel respected and heard, trying to understand what their fears were, and then just sharing my preferences and say, well, you know, I can understand why you feel that, but for my family, this is what I thought was important. Like just those kind of that empathy, those feelings, those personal connections. Honestly, I think that had more impact than, you know, any kind of statistics I could have brought. In fact, I think when people come to you with an issue and you correct them with facts, it actually backfires.
Thank you. Super interesting and very practical advice that we can all use as well. Thank you.
And keep talking. People listen less to
Yeah.
experts and more to their friends and loved ones. And so one of your contributions may not be, you know, on the national stage talking to the media. Of course, do that. Absolutely do that. But talking to your community members, right? Talking to your friends and loved ones, you know, your churches, your synagogues, your mosques, you know, the community groups you're part of, your kids' schools, like talk to everybody. My husband got me a t-shirt because I was doing so much of this. He got me a t-shirt that said like, epidemiologists, feel free to ask me vaccine questions so that I can wear out in public because people just needed information and they wanted to be able to talk to somebody. Now, the reality is they're probably more likely to listen to someone they know than some random epidemiologist wandering the streets with a weird t-shirt. But nonetheless, they want to have that kind of human interaction. And so just keep talking to people.
Thanks, Jennifer. I mean, it reminds me of how when Dean Jha would be on television and he would bring it back to, well, this is what I would do if it was
Right.
if it for my family and for me. And it just took this pressure away. Like people could relate to that a bit more. So I think that's really great practical advice. We have a couple more questions and we're going to open it up for the audience, but I'm going to turn to Lauren next.
We've talked a lot about, you know, some of the challenges that we're facing and that you have faced, particularly in the past few years. And one of the things that struck me is learn to apply the tools to the problem of the day. So separate from misinformation, it's kind of a two-parter. What are the opportunities and challenges that you see for public health as we are kind of entering into new careers? And do you see in the future a new one on the horizon that maybe we should be preparing for now as we are applying these tools?
Yeah, so I don't think infectious diseases are a problem that we are going to solve anytime soon. I mean, when I look at the data, I see very clear signals that the frequency with which we see like new kind of out of the blue outbreaks is increasing. And there's, you know, reasons for that. So when I talk about these things, I say, listen, these are like the recurring hazards of our time, and we're going to just see more and more of these things. And so I'm pushing for, you know, identifying solutions that allow us to be resilient in the face of them, not just like shut our whole world down for a year and then go on and do nothing else, right? We need much more sustainable, you know, solutions to allow ourselves, you know, to be protected in the face of these things, but not to upend our lives in the way that this last one did. So I don't see those issues going away. You know, there are many other threats on the horizon. I mean, and there's also a lot of promise on the horizon. So, you know, AI is one of those issues that I think there's two sides to that. And we as a community need to engage with that. There's enormous potential to make extraordinary advances, and we should absolutely harness them. There's also concern that they can be misused. And someone who thinks about deliberate biological threats, including the potential for the development of bioweapons, that is one area that we have some concern about. So there's a lot of different threats, but in terms of the skills, you know, let me tell you, I'd been worked on pandemic preparedness for 20 years. Wouldn't have imagined something like COVID, right? I mean, I literally been through, in fact, 2 months before COVID or 3 months before COVID, I published a report called like Preparedness for High Impact Respiratory Pathogen Pandemic. And like we had gamed out, you know, a 1918 like influenza scenario and what it would mean, et cetera. But like when I saw a picture of an empty New York Times Square because New York City locked down, I was just like, oh my God, what? So just to say, it's hard to fully anticipate what the public health challenges of the future are going to be. And they're interrelated. I think that's the other thing that we need to remind ourselves, right? You know, for what period of time in my career, there was a debate over which was more important, like chronic disease or infectious diseases. They both matter. And in fact, they affect each other. So we may have interests and we may kind of apply our skills to certain interests, but recognize that, you know, just these issues don't exist in a vacuum. They are very much interrelated. And, you know, the fact that like opioid and overdose deaths increased during the pandemic shows that we have to think about all of these issues at the same time. So I tell public health students, focus less on issues and threats and focus more on tools. You know, fill your toolbox, learn epi, learn biostats, learn, you know, cost effectiveness analyses, learn communications, learn like all of the tools that you'll need to combat problems so that you can apply them. When I graduated from my master's program, I got invited back to the school 10 years after I graduated, sort of like a 10-year reunion, and they brought the class that had graduated 25 years before and the class that had graduated 50 years before. And it was so interesting to see what each of those classes had focused on in their careers. And they were clearly all products of the times that they graduated in terms of the issues that they had worked on in their careers. So I think that tells us is just, you know, build your toolbox, stay flexible, try to grab as many tools as you can while you're in a degree program, because there's just some things that are going to be hard to learn on your own, or just we may not have time to prioritize learning on our own. But if you're choosing between a class that's a methods class or like an issue class, I'd probably always take the methods class. So anyway, that's just my skill. And then probably the communication and writing are probably the two biggest things that everyone will need.
Thank you so much.
Thanks, Jennifer. So earlier you had mentioned about how you had finished your master's just out of undergrad and maybe had not taken advantage of the networking just because you were straight out of undergrad. I finished my master's similarly. For our students that are here now, how can they get involved with you at the Pandemic Center if that's something they want to do? We know that the Pandemic Center is located first and foremost at Brown University, but now there is a hub over in Washington, D.C., right next to the White House. If we have students very much interested in this, how do we get involved?
So first of all, reach out. Second of all, we do have monthly webinars. So those are just things to participate in if you want to learn about the issues that we're working on. Certainly if you're in the DC area, reach out. You know, we do have students sometimes participate in side projects. I'm guessing you all don't have time to add projects to your list, and I sort of don't want you to, because I want you just to be able to finish your degree. But you know, if you have like projects that you need to do for your program and you think doing it through the lens of the Pandemic Center makes sense, certainly reach out to us. Also reach out in terms of, connecting with, some of you may want to change jobs after you're finished with the program or want to get involved with other organizations. Please do that. We do also have a new project coming along that we're calling Biosecurity Game Changers. And I don't have a whole lot of time to explain that to you, but just to say that we might be recruiting people who are sort of earlier career to be part of that program. So just kind of stay tuned on that. If you haven't followed the Pandemic Center social channels, that's how I would recommend doing that. And yeah, just reach out. There's a ton of ways. I think it just depends on what your interests are, and certainly come visit if you're in DC or Providence.
I will be visiting, Jennifer. I would love to see your new office in DC. We do have one more prepared question, then we're going to open it up. So I am going to turn to Maureen to ask that last question that's been prepared, and then I'll open it up to the audience.
Yeah. Thank you again, Dr. Neza, for sharing your career journey. In these last thoughts, what are some information or perspectives you have for those that are taking next steps in our career? So you mentioned even people who may be,
Yeah.
changing. So what are some advice you kind of give for students on that?
One piece of advice, because when students often ask me about like getting a new job, let's just say, what they often do is they go look at postings and they apply to things. I'm not convinced that that's the best way to get a new job, because I will tell you, as someone who's had to hire people, very often organizations have someone in mind before they post something. In part because when you post something, there's like all this paperwork that you have to fill out. Just like it's sometimes easier to find someone and then write a job posting for that person. So I would look at job postings just to get a sense of like what kinds of jobs are out there and what organizations might you want to work with, and then do informational interviews. Reach out to places, say, hey, I'm really interested in your organization, and I'm thinking of making a change and just would love to hear, what you do, and if what kind of skill sets you're looking for. And just, people ask me to do this all the time, and I'm very happy to do it. Do that too. I would go to meetings that you can, and and by that I mean, it depends on what area you're interested in, but as someone who was near Washington, D.C., there were all these meetings, like think tanks would have meetings, and nonprofit organizations have meetings. Just go and meet people and talk to them and just chat ideas. I really think that's the single best way to do it, because sometimes you have an idea of like what kind of career you want or what's next up, and that idea may not map at all on the realities of what it means to work at those places. And then it isn't until you meet people and really hear more about what they do that you realize, oh, that's for me.
Thank you. That's so practical, especially how you were talking about like how current events can really change our interests.
Thanks,
And
Jennifer.
then my overarching measure for staying in a job is whether or not I'm still learning. So if you get to the point where you're just like, I'm not getting anything more, it's time to think about what would be a new good challenge.
Agreed.
We have just a few more minutes, and Sudhir, do you want to ask your question? Feel free to, if you want to unmute and ask your question, or I can ask it for you.
Hi. Hello.
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 Yes. It was very nice to hear you, and I was highly impressed by the all journey and the all achievement. And this question come to my mind. I am the current student of the MPH online. And we used to say we were not prepared in all senses to face the pandemic COVID at the time of COVID-19. It could be because of public health less the funding available at that time. Health policy may not be up to that extent what we expect. The infrastructure was not up to that mark developed. So we have faced a lot of challenges. If we can do that, if we were we were prepared for that, then we can reduce the mortality up to some extent. And my concern, do you feel, are we mentally prepared now to face any further pandemic? For the God forbid, it should not happen. But it comes to my mind, are we prepared? If we are not prepared, then what to be considered most?
So I don't think I would have started a pandemic center if I thought we were prepared. So just to say, the short answer is no. But I don't want to give, that's a very depressing answer, and I don't want to leave it at that depressing answer, which is to say that I think there are highlights now that didn't exist before. So I think there are some real important things. One is that, I mean, I joke, I gave a TED Talk a couple of years ago, and I opened the TED Talk by saying I used to have, when I would tell people that I'm an epidemiologist, they would ask me if that had something to do with the skin. And now nobody asks me that anymore, because now people know what epidemiologists are, for better or for worse. Some people have very strong feelings about epidemiologists, unfortunately, now. So I think, first of all, people, I used to do a lot of consciousness raising exercise to show people how bad infectious diseases can be. I don't have to do that. People know. So that I think is really important. Now, there is some complete denialism that has resulted, and that's a very, I think, common psychological response, is to just say the whole thing was a hoax. But I do think, generally speaking, organizations and people are much better aware of the issues. I also think we made some important developments. I mean, we had multiple safe and effective vaccines in a year. That's an extraordinary accomplishment, a really, truly extraordinary accomplishment. It's the result of a lot of hard work, but it was an extraordinary accomplishment. We also, for the first time, have the ability to test ourselves in our own home and to have ourselves just know that information and to keep that information to ourselves if we need to. I mean, some really important kind of patient empowerment moments in COVID. I think we also, for the first time, are even thinking about the possibility of taking actions to protect ourselves from respiratory viruses. You know, we can use masks if we wish, as a form of protection. We talk about ventilation. So I think there's been some really important developments, but there's a lot more work to do. And I think the thing that worries me the most is sort of how public health has been attacked as a ideology rather than a resource. You know, I used to say to people that public health is at its best when we are seen more like social workers than law enforcement. And I think for many people, public health is synonymous with law enforcement. And so we have a lot more work to do in terms of engaging with communities and making sure their values and voices are heard, to kind of rebuild the relationships and to be seen as trusted community partners who are here to help people live their lives, as opposed to tell them not to do things that they care about.
Thank you. Thank you very much.
Ariel, we're going to give you the last question. Do you want to ask it, or I can ask for you?
Sure, I can ask it. Thanks. Hi, Dr. Neza. I'm really grateful for you sharing your experience and wisdom. So yeah, I'm just curious about the comment you made about how public health for you had felt like it was in its own silo, and now at Brown, you've been able to be more collaborative. So I'm just wondering what that has looked like for you.
So a number of different ways. One is that I get to work with people in different disciplines. So we have a project right now, and I, pulled in a anthropologist from up the hill to help us with it. We're doing work on pandemics and democracies for that thing that I was just talking about, where how public health is being perceived. And bringing in an anthropologist to help us is really important. We have a number of those sorts of things. I will say the most extreme example of a interdisciplinary project that is like beyond my wildest dreams. I wouldn't have been able to do it. Is we launched this initiative called Our Storied Health, where we're exploring using storytelling and narrative in public health communications. And so we're hosting a series of film screenings and panel discussions, as well as workshops, partnering with a filmmaker to do this work. And our next film, if you're in the Providence area, is on February 5th. We're talking about environmental justice. So not just pandemic related films, we're talking about other issues. But again, we're trying to explore how we can use the arts and other things to communicate, because I've found, as someone who is talking to a lot of people, just relaying facts isn't enough to change hearts and minds. We really have to make people feel. And that's something that the arts, I think, are much better at than what public health is typically taught to do. So that's a very probably extreme example, but it's been really rewarding, eye-opening, and interesting.
Wow, that's really cool. Thanks.
So we're at time, but so I just want to thank again, Jennifer, Dr. Jennifer Nuzzo, for being with us. Thank you for highlighting the strengths of Brown University School of Public Health, particularly how interdisciplinary we really are. And you, once you get to know more of our students, because I'm sure they're going to reach out to you, Jennifer, you will see how interdisciplinary our cohorts are, and I think that is so much of our strength. We are learning from each other. We are curious, we are open to each other. We've built, I'm sure, built some lifelong friendships along the way during this journey and during the master's degree journey in the School of Public Health. And we just want to thank you for being who you are and being the terrific leader that you are, and what you're doing for our country and for our world in terms of leading in pandemic response. And it does make me feel just somewhat a little safer knowing that you're at the helm of this. So thank you. And just to the students, this is an example of just one of our fantastic, wonderful, prominent leaders at Brown. I do want and encourage you to really reach out to her. And if you want to get involved, this is the time. This is a time to get involved and get to know what Jennifer does in terms of research and the Pandemic Center in general. So again, thank you, Jennifer. Thank you everyone tonight for attending. We look forward to see you at our next event where we're going to feature another fabulous leader. And thank you again for all being here. All right. Take care, everybody. Good night.
Thank you all. Thanks.